episode of It's Time to Learn, and I'm so happy to be here for another episode. And our first guest today is a trained school psychologist in ADHD. Please welcome Dr. Bradford. Okay, so Dr. Bradford, I hear you've been doing a lot of observations and research with patients who have ADD and ADHD. But can you tell us first off what it is?
Yes, attention deficit hyperactivity disorder is a disorder in which someone has trouble paying attention, has impulsiveness, and also they can have very high hyperactivity. So as you have been working with these patients, what kind of research have you found? With our brain research that we have been doing, the blood flow to the cerebellum and the frontal lobes is much lower than those of that do not have ADHD.
Are there ways of treating it?
One way could be they could use counseling with either parents or teachers, even psychologists. Another way is medications, and one of the ones that most people know of is Ritalin. And this just helps to control their body behavior.
Well, it is nice to know that there are ways that ADHD can be treated. Well, we're going to take a short break, and when we come back, we'll discuss how schools can help students with ADHD.
I've always been disorganized and forgetful. I didn't see my friends having the same difficulties that I did. And when my professor approached me about my constant lateness, I knew I had to do something. So I talked to my doctor, and it turns out I have ADHD.
If this sounds familiar, or if you had ADHD as a kid and thought you outgrew it, find out more. Take a quiz at ownYourADHD.com to help recognize the symptoms. Then talk with your doctor.
It's your ADHD. Own it.
All right, welcome back, everyone. Joining us here now, we have Ms. Smith, who is a parent of the child who has ADHD, and we also have Ms. Wikfors, who is the teacher of the child. So now I understand there's some federal laws that require schools to help students with ADD and ADHD, is that right?
Section 504 of the Rehabilitation Act of 1973 entitles parents to a plan of how the school will meet accommodations needed. There's also IDEA, Individuals with Disabilities Education Act, under which students can receive an IEP or individual education plan.
So it's interesting you talk about the 504 plan and the IEP. Now, what's the difference between both?
An IEP is more structured and detailed.
It outlines all the needs for students, be they academic, social, emotional, behavioral, developmental, or even...
How do you go about creating that?
It's a collaborative effort between school administration, like myself, principals, guidance counselors, the teachers, and the parents.
As a teacher, I would want to observe the student before we have the IEP meeting, and I would use those observations to create a list of needs that the student has, and then I'd look into the different services that the school provides, and the parents should do the same. And then during the meeting, you want to keep everything as well documented as you can.
Schools will try to do what they can, but they are still institutions. So sometimes you feel if they aren't adequately meeting the needs of your child, you do still have the right to due process. The whole thing can be really overwhelming and confusing and maybe even intimidating, but you don't have to actually sign anything immediately, and you can take your time to actually review it.
That's very interesting. Well, thank you, Ms. Smith and Dr. Bradford, for coming in and telling us about these federal laws. And when we come back, Ms. Wikfors will be telling us about the 504 plan and the IEP and the details of how they can be implemented in the classroom.
You know, when I was first diagnosed with ADHD, it wasn't a surprise because I had difficulty in high school focusing. And I think now people notice my ADHD as an adult on a daily basis. When I can't pay attention, I really can't pay attention. And that's why I talk to my doctor.
ADHD symptoms may look different as you get older. Find out more. Take a quiz at ownYourADHD.com to help recognize the symptoms of ADHD. Then talk with your doctor.
It's your ADHD. Own it.
Welcome back. And now we have Ms. Wikfors with us here. And earlier we were talking about ADHD in relation to IEP. Now, how can this be used in the classroom?
There are two things you can do. The first thing is to make modifications that benefit the student, and the second thing would be to modify their behavior through classroom management. Different things that can benefit the student would be things like breaking up large assignments into smaller pieces and giving them different ways to organize stuff so that they're more well organized. We also want to seek them towards the front of the room, away from windows and doors. and just giving them extra time, extending deadlines, giving them a little bit longer in tests.
So you mentioned modifications to help benefit the student, but now how do we modify their behavior?
Classroom management strategies can include things like setting small achievable goals, using when-then directions or just one direction at a time, and varying up the pace of activities. As far as rules, you're going to want those to be clear, simple, posted on the wall, have the student say them, and you're going to want to enforce those very consistently and as immediately as possible, both the rewards and the consequences.
Those all sound like really good ideas, and it altogether sounds like a really good plan.
Thank you.
Unfortunately, folks, that's all the time we have left for today. Tune us the next time on our show, in which we interview John Piaget and Lev Vygotsky on their different views of cognitive development. Goodbye, everybody.